Hi guys, and welcome back to another episode of Made in Practice with yours truly, Dr. Saru. And today I want to ask you, can men actually get pregnant? This is what I'd like us to discuss. Join in. The real question is, do men get pregnant? Can they actually get pregnant? And what is this thing called sympathetic pregnancy in men, or sympathetic weight gain in men? I'd like to first go into the definition of what this means. So sympathetic pregnancy in men, or couvade syndrome, as we call it in medical terms, it is a situation where some men experience symptoms that mimic those experienced by their partners during their pregnancies. So basically, they get the same symptoms like the ones that their partners or their spouses would get when they are pregnant. So what are these symptoms? I have divided them into two: the physical symptoms and the psychological symptoms. We'll start with the psychological symptoms first. So symptom number one, change in sleep patterns. You realize that most pregnant women normally have a change in sleep patterns. So yes, it can happen to men too. The second thing in the psychological symptoms is anxiety. Some men also describe depression, that is point number three, and decreased in libido, and 5, restlessness. So some of the physical symptoms that are experienced by men when they're having this couvade syndrome is 1, nausea and vomiting. Yes, just like the way some women experience nausea and vomiting during their pregnancy, some of these men also experience nausea and vomiting. Intestinal problem or GI problem, that is abdominal pain, bloating, diarrhea, constipation, just to name but a few. Number 3, heartburn. And heartburn is not necessarily the way people normally say, mtoto ako na nywele mingi ndo maana nimekuwa napata heartburn. So how is it like kama mtoto wewe ndo umembeba na ako na nywele mingi, then the husband is getting the heartburn? So you see, heartburn is because of even the increased intra-abdominal pressure and the fact that the baby is pulling, or rather pushing, your stomach up above, and then you tend to get the heartburn frequently. So yes, heartburn. Point number 4, changes in appetite. Sometimes you feel like you need to eat or binge eat. Sometimes you don't feel like eating at all. Then there's number 5, weight gain and weight loss, depending of course with the changes in appetite. For those people who don't want to eat a lot, they'll tend to lose weight. If you're also experiencing anxiety or depression, you might also lose weight. If you're binge eating because of depression or anxiety, you might again gain weight. Interestingly, point number 6, yes, some men do experience toothaches during their partner's pregnancies. Number 7, sometimes you might have back pains, mimicking almost, especially in the 3rd trimester, as if it's true you're really carrying something in your stomach and it's getting a toil on your back. Then skin problems. You might develop acne and of course some rash on the facial or even some other areas, but mostly facial acne, the same way pregnant women normally get due to hormonal changes in the body. Leg cramps. Number 10, there's some men who have been reported to faint during when they're experiencing this sympathetic pregnancy. Weakness, general body weakness and feeling fatigued, and urinary irritation or genital irritation. So now that we have known what are the symptoms or what is the presenting complaint of this man or these men who are experiencing couvade syndrome, you might want to ask, when does it actually occur? How does it occur? So let's dive right into that. So it normally starts during the 1st trimester, and it's reported to disappear in the 2nd trimester. Then it tends to reappear again in the 3rd trimester. And this time when it comes back in the 3rd trimester, the symptoms are normally worse than they were initially in the beginning during the 1st trimester. So you get to experience a bit of everything. Not all the symptoms that I have mentioned here are what you're going to experience altogether, but yes, sometimes you might get the whole load. Sometimes you might have a bit of here and there symptoms, hapakule, what we call them. So sometimes you might have the nausea, sometimes you might not have. And for some people, in as much as we say it, according to the research that has been done, it normally reappears in the 3rd trimester and it's worse. Some people could have it all through the pregnancy, from day 1 until the time that the mother delivers. So again, when do they disappear completely? Of course, after the birth of the child. Just like the same way a woman who's pregnant tend to get a woozer moment after they deliver, then that's the same thing that happens to also the pregnant fathers. It also disappears during that time. So some of the treatment, actually there's no treatment for this condition, because you've seen most of these symptoms that I've mentioned are mostly psychological. So because of the nature of it being psychological, so I earlier mentioned there's no specific treatment for this syndrome. However, there are steps that you can take to try and ease the symptoms, and here are some of the steps that you can take to ease your situation. 1, prepare ahead of time. Where for the partners or for the couples that are actually anticipating and trying to actively look for a child, then that's the time that you start to prepare yourself mentally. Maybe talk to somebody, maybe go to prenatal classes and start reading books, start reading blogs, start watching drsaru. You know, you can get something and some tips that can help you to ease up with the process. Yeah, so you prepare ahead of time so that you're psychologically not extremely very anxious, especially for new fathers. It's normally something that happens that they're very, very anxious about. For new fathers, they tend to get a lot of anxiety because of the unknown. It's new waters, you understand? They've never been there before, so the pressure is normally high, and the stakes are also always high. So preparing beforehand, before you go to the conception period, before you now know you're pregnant, as you're walking through the journey, it's important that you have prepared yourself enough. The second thing, after you have noticed that you're suffering from any of these above symptoms that I've mentioned today, please talk to somebody, a psychologist, a friend who maybe you know went through the same thing. People have groups nowadays that link up with people who have experienced the same kind of situation. So maybe get yourself a support group and talk to those people so that you can be able to understand you're not alone in this. And this is a common thing, not very common, but yes, it's something that can happen to any man out there. Either you're a first-time dad, or maybe you're a 10th-time father. Like, it can happen to you at any given point. So yeah, relax, talk to somebody. The third thing, which is finally going to wrap up for us today's video, plan ahead for the challenges. You remember I told you about prepping. Prepping is different from planning for the challenges. You see, when you're psychologically prepared for the challenges, you're planning ahead in case this should happen. Maybe you have a kitty that you already put aside even for the delivery process, the bringing of the child. So it helps you to have less anxiety about the whole process of you being a new dad. And for all the new dads out there, congratulations. And I thought you should know, it's not that it's in your head and you're not crazy, that you've been feeling like you want to puke the whole day, or you've been puking every morning or every evening or whatever time, and the backaches and all the stress and the anxiety. I want to assure you that it is well. And when you get that bundle of joy, it will even going to be better. Until next Friday, it's drsaru. Love and love.